All right, well, it's a little after 8. We'll get this thing started. I'm going to go ahead and share my screen. See this banner. My name is Justin Chu. I am the current fellowship class representative to the fellowship committee as the liaison, and we're here for this webinar, the SMFC webinar, for the incoming fellows giving advice and insights on preparing for the sports medicine match. So thank you all for joining us. We have a great list of panelists here to talk about the different tips and tricks they have to the sports medicine match, which they all successfully matched into. So congratulations again to them. We're gonna have the screen available for chat, and then we'll be able to have some preset questions that people can answer, and then from there we'll be able to go into the actual rest of the discussion. So that's just the intro. So again, please remember to mute your microphones as courtesy for everyone on this call and people listening in the future to make it easier for them to get all this content in an appropriate manner. And again, I want to thank you all to the panelists who are on board. I'll let them introduce themselves. If you don't mind sharing where you're coming from and where you're attending for fellowship, that'd be helpful. So we can just start with Morgan. And I know Dr. Epstein's not here, so we'll switch to Dr. Liotta after that. So if you guys can all...
I'm back. Hi.
Oh, sweet. Nice and fast.
All right. Hi, everybody. I'm Morgan Chambers. I'm currently a resident at Penn State Hershey Medical Center, and I'm staying there for fellowship starting in July. It's really nice to see all of you and can't wait to talk more.
Hello, everyone. Charles Chatman, currently at University of Mississippi Medical Center, and we'll be going to University of North Carolina, Chapel Hill for sports medicine fellowship.
Hi, everyone. Ari Epstein. I'm an attending and clinical associate professor at Feinberg School of Medicine at Northwestern. I graduated a few years ago, and I'm going into University of Rochester sports medicine.
Hi, everybody. I'm Liz Liotta. I am coming from WVU Hospital, going to Cleveland Clinic, and I apologize if you hear my baby in the background at any point during the session. But I'm also an incoming fellow liaison for the International Interorganizational Relations Committee.
Hi, everyone. LaRae Seemann. I am coming from Mayo Clinic in Jacksonville, and we'll be going to University of Florida for fellowship. Again, if you hear my dog in the background, she might decide to make herself known throughout this.
Hey, I'm Jeremy Swisher. I'm currently a family medicine resident at Wake Forest University and going to UCLA next year for sports medicine fellowship.
And Dr. Wainwright not be with us now, but maybe she'll hop on. So we'll keep powering through. So first question, whoever wants to take a stab at it first. How did you choose which programs you applied to?
I can start. So for me, I had a few different priorities. Geography wasn't quite one of them. So what I was looking for in this really condensed year of training was specific coverage. So I know I wanted to be either D1 or close to that, and professional coverage, because not every program provides either or both of those. And then also ultrasound training. So you'll see when you do your research on different programs that some emphasize it, others really don't. So if that's something that's more of a priority for you, then that's something that you should definitely look into. And the programs all have information on whether they provide that or not. But geography was less so for me.
I can take a stab at this next. So I kind of took a unique approach and asked my mentors, hey, the sports medicine community is really small. They all know each other. What programs do you think would be a good fit for me, having gotten to know me over the past few years? And in addition to doing some web-based research and having the visibility of programs at national conferences, I really kind of went a personal route because I was looking for strong leadership and mentorship. So I kind of navigated looking for programs a little bit more personally that way. And again, did not constrain myself geographically.
I can kind of go next and piggyback off of the last two answers. So I did take geography somewhat into consideration, but I still applied very broadly. And again, I took a lot of mentorship in terms of I just kind of got a master list of programs that I was interested in. I did talk to a lot of people at the fellowship fair at AMSSM going into my third year, and just really kind of held on to those connections that I made there with programs that I was interested, and then asked my mentors what they thought would be best for me in terms of fit. So I ended up applying broadly from a geography standpoint, and then similarly to other folks, I looked at not necessarily division coverage or level of coverage, but different sports that I wanted to be exposed to, as well as ultrasound training and ability to incorporate standstill research that I have right now into my fellowship year.
I'm planning to do academic sports medicine after fellowship, so I was looking at a lot of programs, kind of broadly, not too focused on location. Like a few people mentioned that were good at training for academic sports medicine. Also was really interested in team physician coverage, so doing a lot of time in the training room, as well as getting to cover a lot of different levels of teams, like professional and Division I, Division II, things like that. So those were the different programs I looked to apply to.
Yeah, like Jeremy, I wanted to make sure I was going to an academic program. Being in academics already, it's something I wanted to continue for faculty development and making sure that there's a robust, pretty well established pathway for faculty development. So that was really important. And then also for me, I really like mass medical event coverage. So, marathons, triathlons and stuff. So that was interesting to look at to see which ones were doing more kind of your team-based coverage, as others were doing kind of from planning and organizing committees to where you're actually running the races and having that experience when you finish as well.
I don't have a ton of diversity to add to this. I had some great help from mentors. I will say the hardest thing for me was narrowing the list down. I felt like in using all the same criteria that everyone else did, my list was just way too huge, and I wasn't actually going to apply to that many. And so my partner did a lot of it, honestly. And it became a little bit of like, okay, we have a Midwest group of programs. We don't need to apply to 10 programs in the Midwest. We don't need to apply to 10 programs in the Southeast, whatever it is. And so just trying to pick the best of each of those. And then I would say, mentorship is really important to me. And so it was one of the big things that I limited programs based off. If there was not a woman on faculty, if there was not kind of clear prioritization of mentorship and relationship in the program, then that made it off the list.
Katherine, I totally agree with you. I feel like when I was just going with my like primary criteria, my list was massive and I just don't have that kind of money or like bandwidth for that. So then I kind of like went into my subdivision, talked to my husband, and then we created other priorities. So like the ones that you mentioned, but also the number of fellows, because that's variable depending on which program. Some people are okay by themselves. Others may want more of like a co-fellow setting. So there are definitely some subdivisions that I had to create after my initial list was done.
And I'll just say, if you're someone who doesn't know what you want, like you don't know if you want the ultrasound focus, you don't know if you want D2, you don't know if you want XYZ, that's fine. I knew that I'm someone who likes to defer a decision until the last possible moment. And so I actually kind of prioritized diversity of research focus, diversity of coverage, diversity of whatever it might be. So I applied to some programs where you're the only one and some where you're one of four, and tried to intentionally have all bases covered. So there was at least one program where if like the day before ranked list, I decided that was the most important thing to me, I knew which program I would put first.
One thing I did was I would go into the fellowship website. I'll look at the recent graduates and I'll just Google their names and see where they're doing now. And so if they're doing something similar to what I'm interested in, I'm like, oh, I'll definitely keep them on my list, because the program can say, oh, we'll train you this way, but I'm like, let me see exactly what you're actually training. And so I would just Google the names that I saw on the website and then go from there.
Similarly to that, I looked at a few of them had Instagram pages, so you're able to see kind of what the fellows have been up to, and they've been doing ultrasound or the sideline coverage, and that kind of stuff was cool to see.
Guys, these are great. I love it. Oh, sorry, Liz, were you gonna say something?
Yeah, I was just going to say one other thing. did something similar where I looked at the faculty even, and if they did their fellowship at the same place that they're now a faculty member, to me, I interpreted that they're happy. They're happy, they're sticking around, they had a good fellowship year, and they wanted to continue to be there.
Yeah, I was just gonna say those are all great. I love you guys hit a lot of the high points that I felt like was important for my end too. Hitting all those buckets of like coverage, curriculum with ultrasound stuff, geography, mentorship. The fellowship fair is like a huge thing that I feel like AMSSM does very well at. If those of you who are going to apply, if you haven't had the chance to go and can go this next year in Kansas City, it's extremely helpful if you're able to do it before you apply to get, again, kind of get the ground roots of like these information and things like that. So great coverage on that one, guys. Next question. Since most programs have core requirements, what program aspects did you
I
find
realized what time it was. I'm
main
like, oh shoot.
differentiators besides location? I guess we kind of hits on some of these, but
I mean, I'm here all week, but she needs us today.
One thing that I was just kind of thinking about, because we kind of already touched on a few components to different factors that you look at in programs. If, and kind of what echoing what Katherine said, if you don't know like what niche or what's area of sports medicine that you're interested, I think that's totally fine, and you'll probably find that and or something different later on. But for me, like I definitely had certain interests. So if a program had certain aspects of either their website, or you talk to them at the fair, or you talk to fellows about different electives that are available, or different like unique opportunities that can help you kind of edge forward in that area of sports medicine, I think that's really important, because the fellowship year is so short and so fast that if you want to kind of push yourself forward in that area, it's important to have some of those things at your disposal during your year. So that's something unique that you could look for. And I actually, on my spreadsheet for when I was going through the interview trail, I had a column of like extra things that would be on my pros list to help me kind of forward in that area of my interest.
Yeah, Morgan made a really good point about marketability once you're done, because if you have a skill set that other folks don't, I mean, I'm in Chicago, it's a super saturated market. So however you can differentiate yourself, if you're not someone who may want to do a hybrid model and you're looking for more of an exclusive practice, having, more procedural experience or exposure in your fellowship year would be important. And that helps differentiate between, certain kinds of academic versus non-academic programs. So I think understanding what kind of practice you'd want to have in sports medicine is helpful to see where those different edges are within a given program.
So something else during my interview trail, which I asked about, was the continuity clinic, because that differs depending on the program. So you can do more of an urgent care type setting, or you can be true family medicine. You have your patient panel for the 1 year, or maybe you're precepting residents. So that's something to keep in mind and ask when you're going through the process.
Some of the stuff that I had written down from this was just looking for strong leadership, and you can say that all day long, but you kind of want to see that demonstrated. So, for example, when you're going to conferences, you're seeing who's lecturing, what kind of visibility a program has. I was looking for something with a really strong academic foothold, that already had a set framework for me to continue research. And, while a lot of core requirements are the same, a lot of the same resources aren't there at every program. And so that was something that was important to me. Also, somebody who could kind of tell me like clear definitions of what a successful fellow would look like to them, someone that would thrive in their program. Because I feel like when people have a more defined vision of like what kind of fellows they want to train, you can either see yourself fitting into that better, or realize that, hey, maybe that's not the program for me.
One thing I saw that kind of differentiated a lot of them too was just the different levels of coverage, like we talked about a little bit. Some have all different levels, like we talked about: professional, Division 1, 2, 3, high school. But the involvement that you can get kind of hands-on and whatnot can be very different in different ones. So kind of talking with the fellows and faculty and kind of seeing what that looks like, whether it's just shadowing with the Division 1 or 2 teams, or if you're some programs you're doing weekly training room and covering all the NFL games and stuff. So it could be very different depending on each program.
Sorry to chime in again before everyone could answer. This is just something that kind of caught me as a surprise that I wasn't necessarily thinking about before I started interviewing. But asking about like the level of supervision that you're going to have at your coverage events, and just came as a shock to me that some programs were vastly like unsupervised, like first day of coverage, you're just kind of going solo, going rogue with these athletes, and then other programs they're like very supervised where you have levels of people there. So just keeping in mind kind of like how much exposure you want, and seeing, you know, kind of how programs differ in that area.
Oh, these are good. I don't know if I have too much to add or offer. I can say I forgot to mention that I'm finishing up my fellowship at the University of Louisville. You can see that little icon on the bottom there, and I'm actually staying on as faculty for the next academic year. So someone mentioned earlier about like where the fellows go and stuff like that, and where their dream job, and kind of just wanted to retouch on that it's easy to find out where other people go to, and like the whole train and retain aspect, and again where they go following fellowship. I do think that's an important aspect, and outside of like core requirements, other things that exist, or sometimes urgent cares, sometimes it's a part of a program. Sometimes like where I'm at, we can work an after-hour shift at the orthopedic urgent care, but you get paid as not in addition to your fellowship stipend. So that's just another added bonus where you can get to see more patients, get more practice, get more hands-on experience. There's no one else there that you're staffing patients with, so you're the only provider. So if other programs have that type of model as well, that's another great place to see a lot of like fracture management that you don't always get to see in clinic. So another thing to think about. One other thing think I wanted to add about too is a lot of programs have more pediatric experience, if that's something you're interested in too, compared to others, and some of the numbers just vary, but that'd be another question to ask about if that is something you're interested in. All right, moving on. What proportion of your interviews were virtual versus in person?
I actually went back on my spreadsheet to look at this, and I think it shaked out to 70% virtual, 30% in person for me, and that was applying broadly geographically. But I did also notice there is a very heavy propensity for West Coast programs to be virtual. Most of my in-person interviews were programs on the East Coast and in the Southeast.
Mine was the same exact percentage, that 70-30, although I'd say the ones that were in person were more scattered for me, and one of those programs offered both in person or virtual.
Yeah, I ended up applying to or going on 12 interviews, and about 5 of them were in person, and 2 of the in-person ones, one was in California, one was in Utah, so a little bit of West Coast as well.
I had about 20% in person. And that's excluding, since we don't, at my program, there's no sports medicine track. So I ended up taking some of my elective time and doing essentially aways. And so 1 month at a program, and 2 of them kind of folded an interview into that. And then I eventually did have a virtual one if it was like a month or 2 afterwards. But when I was there on site, I did one in person. So I guess 4 total out of everything that I gotten.
So yeah, I went on, I had 18 interviews and 5 were in person. And so you all know it's going to vary. From some of the program directors I was talking to, they were saying they would like to move more toward in person, just because you have to put a little more skin in the game. We have to physically go somewhere, pay money, get transportation, get a hotel room and things like that, rather than just going on Zoom. So I heard like some program directors would like to move more towards in person if they could.
Just to give the balance to that, I'm at UW and staying at UW, and we have at least been so far very clear that we will always be virtual. So I think in general probably more towards in person, but there are definitely some that are going to be virtual forever.
I interviewed at 15 places. 2 of mine were in person, 1 in North Carolina, 1 in Virginia.
I interviewed at 14, only 1 was in person. That was here in Chicago.
Just to expand on that a little bit, and I know this isn't the question specifically that was asked, but it is a different experience when you go in person. Obviously, it's expensive. You may not have the time to go with your schedule, but you do get a feel of the faculty, of the current fellows, of the relationships between people. So although it is a lot to ask, I think, of the fellows, or sorry, the incoming fellows who are interviewing, you do get a little bit more from being there in person.
Sorry, let me just say this because this is very helpful in the sense that like you don't have to stick to the rigid question per se. If you have something that you want to elaborate on that you think can help future applicants, future fellows in terms of like proportion of interviews that were done virtual versus in person, what you thought about it, I think that would be helpful for everyone going forward. So you can feel free to, whoever wants to chime in and take this a different way, just kind of use it as a booster. But yeah, we'll keep conversations going well because this is helpful.
I just agree with Elizabeth, and it's not really anything that you can like choose or influence unless you have one of those rare programs that offers both. But I'm only just realizing that outside of the program that I'm staying at, the rest of my top 4 were all programs I was at in person. And so it's probably not a fluke. I think like being in person, you have a much better experience.
Yeah, I would agree with that. I had a hard time comparing like apples and oranges, making my rank list for programs that I really thought I got a decent sense of virtually, but it just didn't compare to, some programs. Like I can think of one I spent essentially a whole weekend between like a social, an entire day, a tour. And then I had programs where it was maybe a 1-hour virtual format. And it was very difficult to try to compare those programs, even though they may have been pretty comparable. At the end of the day, I think I was biased towards in person.
I think so as well. Now that you mentioned it, Kat, I think 4 or 5 out of my top 5 were also in person. The one that wasn't is where I matched, but also did it in a way. So that kind of gets there. And I think it comes down to like you were just saying about getting to do all the different things with social, whether it was root beer and pizza with Kat in Utah or watching her drink Red Bull in New York before one of the interviews. It was cool just getting those different experiences, getting to listen to everyone and get all those different opinions. The one question they just asked from Kyle, one of mine was virtual, and then they had like a in-person social like in December, so closer to rank list being due.
I say as well that a program's ability to organize things effectively, not just through the actual, if it's virtual or not, but just through the entire process, really also helped me understand whether or not I, would be happy, as someone who might want to do more of my own rotations and just seeing how the logistics would work and just if they're administratively organized was also a factor for me. So, when the interview day or communication was just really poorly done, that was a factor for me in deciding where to rank as well.
So I guess this kind of takes us to the next question, but like the different interview formats, can you guys talk about those? And you could take the different approach of in person versus virtual. And I know you mentioned some of the duration of time, whether an hour long, but like what did you traditionally see?
I think most of them for the actual interview were some form of, you're in a room, whether in person or virtual, with a faculty or 2, and they have some topic of questions, and then you move to another and they have a new topic of questions. And so you get to interview with a bunch of different people, faculty and sometimes fellows. And then there was some manner of tour again, whether in person or not. I would say most of the ones that were virtual were like half-day things, although some of them were as short as 2 hours. The ones that were in person were whole day things.
Yeah, I would agree. Most of them were kind of like round robin style, as Catherine kind of mentioned. There were very few programs that I interviewed with like more than one faculty member in a room. Most of it was like one-on-one with a faculty member. I talked to most of the fellows at most of the interviews. There was almost always a session about like benefits and all of those questions. And then there was also a section for a tour. Most of the time, like if you were on break from like a virtual standpoint, you were just kind of like in the waiting room. Some programs while you were in the waiting room had someone there that you could ask questions to randomly, or you could just actually take a break. Most of mine were half-day things. I think one of them was very short, and then another one I had like a 2-hour break in the time frame of like 4 hours, so it ended up only being like a 2-hour duration.
I agree, had similar experiences to the two of you. The virtual interviews I found to be very short, so about 8 minutes to 12, maybe 15. It's hard to get a real sense of that interview session as it's happening when it's so abbreviated. And then for actually where I ended up matching at, I think I started with the associate program director, and for whatever reason, we were both having technology problems. So 4 minutes in, I think I missed a third of that 12-minute session. So it can add a bit of anxiety to it when they're so short. But I had similar experiences. Fellows were typically either there on the sessions themselves in the break rooms, or they had their own group interview spot, or you had a virtual sort of social hour the night before. And they may be in attendance for the interview as well. But you typically always spoke with the fellow or fellows, had dedicated time towards that, and then either individual sessions with faculty member, or a lot of them actually had a primary care sports medicine in addition to an orthopedic sports medicine together. So you can get that dual perspective in that same session.
So I can speak on a little bit on in-person interviews. So in-person interviews, some of the ones that I experienced would be where like the day before you would actually go to like a sporting event and be on the sideline with the physician, talk to them, things like that, watch the game. And then also you can go to the clinic with the fellows to see what they're actually doing. And so that was some of the in-person experience that I had during my interview.
Just another quick comment, both in person and virtual. Some of the programs I really like, they took more of like a multidisciplinary approach. So we were able to talk with some of the athletic trainers, some like therapy services as well. So that was really interesting because you're going to be like working really closely with the athletic trainers. So it was good to kind of get to know their personalities and their perspectives on everything as well.
All right, thank you. One more preset questions before we open it up to questions from the audience. So I don't know if anyone was affected by this or had this influence, but what are your thoughts on geographic signaling and how it affected your interview invitations?
I can speak on this from someone who limited myself pretty significantly geographically for residency. I had decided at the beginning of this that I was not going to do it this time around and just didn't want to limit myself by like signaling a certain area. But that was because I was also truly open to going anywhere. So I think if at the same time, if I had wanted to limit myself to an area, I think it's perfectly fine to do that and just be really transparent about where you want to be. You know, at this point, you're looking beyond like to a career. And if there's a certain area you want to live in because of family reasons or anything else, you know, I think that's certainly like reasonable to do. It may obviously affect if you say, oh, I want to be on the West Coast, you're probably not going to get as many interviews, you know, on the East Coast or Southeast. But if that's where you want to be, you know, the thought is that should be okay.
I completely
I oh,
didn't
go ahead.
have
Sorry.
I didn't have any one specific area or region really that I wanted to end up in and land in. So it's not something that I did. And I don't know whether it harmed or helped me, but I did end up where I wanted to go. So
I also ended up not clicking any of the geographic signaling. I was just trying to apply pretty broadly and didn't want to limit that part.
And I just panicked when I saw it and texted Jeremy. So then I ended up also not putting a geographic preference.
I did the signaling and found that I mean I'm assuming if you're doing that you should be intentional and be pretty forthcoming and articulate for why you'd want to be there. So I think they can sniff out pretty quickly if it's more kind of contrived reason as opposed to like family or some roots in the area that would be important to you. So that was the case for me, and I certainly found no real difference in terms of the interest from the Mid-Atlantic and Northeast relative to the Midwest when I was applying.
I'm gonna be honest, I didn't know this was a thing until I started reviewing some resident applications when we were interviewing for our residency program. So I didn't end up doing it, but I also applied pretty broadly. And ultimately, so I'm from Pennsylvania. I've been in Pennsylvania my whole life. When I interviewed out west, they're like, what are you doing? Like, why are you interviewing out here? So you end up having those conversations anyway about geography. So I didn't feel like it was necessary for me, but definitely has its place for others depending on the situation.
Excellent. Thank you guys. This was something that was getting new to me as well. So it's great to hear your guys' insight on it because I'm not sure how it affected other people going forward too. I do think it is sports med fellowship goes by quickly. So I agree that you want to get all the best learning and teaching experience you can and make that year worthwhile. So I think it is in some ways if you are able to apply broadly and not keep yourself into a region, it can keep your opportunities more endless. So then we can kind of go forward into questions from the chat, and feel free to enter any more people who are logged in. But one of the first ones, how many programs did y'all apply to in total?
I didn't open up my spreadsheet and take a look, but definitely a few dozen, more than I needed to. And part of that was because I don't come from a program that has dedicated sports medicine doctors, doesn't have a sports medicine tract. I essentially had to find all my opportunities when it came to coverage from high school to collegiate to anything that I did. So I was fearful that that might put me at less of an advantage or an edge. So I applied to quite a few, honestly, probably a few dozen programs. And I did end up getting 17 interviews overall. But just because that's my experience doesn't mean that others need to apply that many, but I definitely did.
So I spoke to my mentor about this because honestly, there was not a lot of good information out there as far as like how many you should apply to. I have a lot of imposter syndrome when it came to like how competitive I was. And then I was told that as a female, that might be like that I might need to apply to more programs than a male would, which I'm not sure how much truth there is to that or research to back it. But my mentor ended up telling me 30 programs. I thought that was a little bit overkill. And I backed it down to about 25 and got interviews at most of those. But I felt like in retrospect, I probably was pretty competitive. But it's kind of tough to narrow it down for sure.
Yeah, I think I started with a pretty large list and was able to bring it down to about 15 or 16 or so, and then going on about 12 interviews or so.
I applied to 13. I tried really hard to get it to an even 10, and I just couldn't.
I applied to 25. Oh, I applied to 25 as well. But like we said earlier, I just definitely made sure that I talked to my mentor, about specific programs to make sure that I was applying to the right programs based off of my career goals. So I just think it's very important that we all just make sure we have a mentor that can help you through this process. Someone who's probably like a year or two out, or just finished, their fellowship, how they just went through the process, I think would be very helpful.
All right, perfect.
I had,
Go ahead.
sorry,
No, go for it.
I was just going to echo. I'm looking at my spreadsheet. I had 23 programs on my initial draft. My mentor helped me wean it down to 16. I applied to 16 and got 15 interviews.
These are good numbers for people to hear, talk to mentors, sift through the list, filter through again. Excellent. Next topic people are asking about too, and I know Kat kind of answered it, but for people who haven't read the chat, but how many people had like offers for like a second look kind of look for, especially if you did a virtual interview, and whether or not you felt inclined to go or did go?
I don't think I had any extension for a second look. I think it was understood that if you wanted to go, you could reach out, but no one specifically said we're offering this if you want to come.
I had 2 programs that offer second looks. I did not go to those programs for a second look, just for the costs, but because you already interviewed there, and it's like, at least for my institution for residency, we had to take vacation to do interviews. And so I already used a lot of my vacation on interviews. So when it's like, oh, second look now, I'm like, I already spent the day, one of my vacations to interview with you virtually. Then it's like, oh, okay, then I need another to go there in person. So I didn't have that many days to take off from residency.
I did have an extra vacation day, and there was a Friday one in December, so I made a 3-day weekend out of it and did some hiking. It was a lot of fun.
What are people's thoughts on making a personalized personal statement? Is it a must for a specific program? Or if anyone did that?
I would say only if the program requires it on their website. And there were a couple that said, like, tell me specifically why you have an interest in this program. And to be totally transparent, I mostly just added a sentence or two to my personal statement. And that didn't come up, and it didn't seem like they looked poorly on me for it, but I can't be sure. That said, if you have a program that is absolutely the one that you want to go at and like put all your eggs in the basket, then for sure it's worth creating a personal statement that is specific to that. But I don't think you'll ever be knocked, or like they'll ever think that you're not interested if you don't do that.
A lot of the programs I applied to, I think maybe one asked for a personalized one, and just to echo, it was like a very short addition to my baseline statement. A lot of the programs, actually, probably half of mine asked for supplemental materials. So like extra list of like questions that ask a little bit more about you as a person or about your interest in the program. And so I found that a lot more than requiring a personalized personal statement to that program itself. I think that you can be really tactful when you're writing your personal statement, because if you're already reviewing the website and you kind of have a general idea of the program you want to go to, you can formulate your personal statement to target a lot of programs that you're going to be applying to just by your general words. So I think you can be very tactful about that. And again, going back to having a really good mentor to help review those things for you is key.
And Jeremy, I think you kind of talked about doing an away rotation. Anyone else want to talk about too, or Jeremy, again, about away rotations, electives? Think they're imperative at this stage, especially like you mentioned too, Charles, like trying to find time with vacation times that you have and kind of using that. What are your thoughts on that, everyone, or whoever wants to talk on it?
So I ended up doing, I guess, sort of 3 in total. Since I'm a community hospital, but under the WVU umbrella, in my second year, I did a month in Morgantown at the main campus there. And then in my third year, I did two different away electives, and I want to say that I did one in like September and the other one in October. So two reasons why I chose those months, because you're right before and then starting into your interview season. So you can really get a feel for what goes on at those times. And most programs I had looked at to do my research instead of where I wanted to go specifically, they recommend, if you do want to do that, to start looking in the springtime, early spring, I would say, of your second year, if you want to set it up for your third year. So you have to have an idea months in advance and to start looking and getting in touch with those programs.
Anyone
I
want to talk?
think you
Yours.
I think it'd be okay if you can't do it. Like I tried to do two, but it just didn't work out. The program did see that, I was interested, and they're like, oh, okay, at least he tried, but it's not end all be all. For some reason, your schedule doesn't work out, and you just can't do an away rotation. Things happen. Some programs or institutions don't even allow their residents to go away, especially if outside the state. And so it's a little tricky sometimes to be able to do that. So if you can, but if you can't, then don't feel too bad if you can't do it.
Yeah, definitely can be hard to do. I think I wrote like a 6-page essay to my program of why I should be allowed to go do an away rotation. So it can be difficult to get them. If you are able to do one though, I found it pretty helpful. Spending a couple of weeks kind of getting to know everybody and kind of get the sense of the culture and the different procedures and coverage and stuff they do. So similar, I think, to how we were talking about in-person interviews. It's just nice being able to see some of the things in between.
Yeah, just to reiterate, I don't think it hurts you at all to not do one, but I do think it's really helpful for you to have a better picture, especially if they're just going to do virtual interviews, to be able to be there and get a feel for it.
Who would like to share how they improved their CV during residency?
I will. So for me, it was just about coverage. I've already mentioned this, that we don't have anything preset in my program. So I knew that I wanted to really have programs take me seriously, because one thing that they do look at is longevity of coverage. So it's not necessarily the variety of what you're doing, but are you doing this throughout your residency training or beforehand? Do you have actual interest in the career, that you're not just someone who's deciding last second that they want to go into sports medicine because they think it's cool? This is something that you're taking seriously and you want to be a professional within it. So I started to look for avenues to have coverage in my first year. So that's something that I knew that I had to prepare for early on. And that's probably, I would say, how I spent most of my time improving my CV.
Yeah, I think Elizabeth made a great point about just having continuity with it's just like, with clinic patients as well. You're developing relationships, you're demonstrating that you're committed to a sports medicine career. And I guess because I'm the old guy here, most of I was an intern when COVID started, so most of our coverage was gone for at least half we just had nothing. The state had closed down most of the sports coverage, as well as our D3 affiliate. So we weren't able to do anything. And then as an attending with 2 jobs, I just tried to make sure I could find time where I could, which was typically with these mass medical events, they were on the weekends. But it was within those circles I was able to develop those relationships and have that continuity, which really came through, and wasn't just something that was consistently asked about during the interviews, but also was able to weave into a fairly compelling kind of theme as part of the personal statement. I just think writ large, regardless of if it's a personal statement or not, it just should be something that is, I mean, of course they should be genuine, but there should be some kind of central theme to why you want to do sports medicine. And if you, as someone has said, if you're tactfully saying, okay, if I want to, do academics, for instance, and you're touching on a lot of these parts that are core themes of what these programs are, that will come through. And I think that's something that was, pretty consistently asked about in the when I was actually doing the questions and meeting people face to face.
Just on a tangible, I have like every 6 months or so meeting. I'm in a place where there's robust like framework and mentorship in sports med. And so every 6 months or so I'd have a meeting with my like sports med mentor and say, hey, this is where I'm at looking forward into application and stuff. Like, is there anything I should be doing in addition? And he would occasionally be like, oh, you should really be getting involved in research now, or you should be doing XYZ. And so if you have that in your program, that's incredible. If you don't, I would encourage you to try to find a mentor like through the AMSSM mentor match or something, so that you can have that check-in as you're going through residency, and they can like open up your blind spots a little.
Yeah, I think being proactive is like a key like theme of trying to like plan ahead, because it's such a busy time. You know, I remember trying to like get inpatient to where it wasn't in the fall so I could do more football coverage, and like that was like pretty way ahead of time. But you know, I'd be leaving inpatient sometimes and going straight to football. And so you just have to kind of like create opportunities where sometimes you may not truly have the time. And then if you miss out on some because of your regular residency schedule, I think that throughout the process, something that got commented on a lot that I had done personally was like reaching out for different types of coverage. So, you know, I'm in a big academic center and we have actually a great framework, but I wanted to do some combat sports and that wasn't available. And so I kind of reached out to the Ringside Physicians Association and tried to get some of that on the side. So those initiatives that you take, even as a resident, if you have like, you could squeeze a 3-day weekend or something and do something directed towards what you want to do. Like everybody keeps saying, like paint a picture, like having a story of why you want to do sports med. But I think just taking advantage of creating opportunities is important.
And kind of to piggyback off of that, what do you guys think about how much coverage you had during residency or attending life to make you competitive? And do you mind sharing like experiences and things like that for these people asking? What do you think a good number is for experiences for sideline coverage?
I think
this. Sorry.
I was just gonna say, I think someone who already highlighted, I forget who said it. It's not necessarily the number, it's more of the quality of the experience, the longitudinal, the continuity with different teams and athletes, as well as probably diversity, throwing in different sports, I think as Leanne mentioned, and then also throwing in some mass participation events too. Those are pretty huge just to kind of hit different pillars of coverage.
Yeah, I guess I would say I was just constrained by the continuity I could do. So for me, it was always mass participation, but within those, there was variety. It was, you know, triathlons, swim events, you know, the Chicago Marathon. And within them, then leadership opportunities started, right? Because of that continuity, because of those relationships developed with the organizers. And that's where you started to see a lot more value to what you're doing. So I couldn't ever do, you know, Friday night coverage. I was always working. And so that's where I just had to put my time in, and that's what ended up working for me.
Just to jump into the next question, because I think it relates, structuring the CV was surprisingly hard because URAS is so limiting. But I would put like, you know, UW women's soccer fall 21-22 season, whatever, and you know, 7 games in parentheses or whatever it was. Please don't judge me by those numbers. I just made them up. They might be a total lie. And so I would put like a broad title and then a, you know, was this a like my high school continuity for many years, or was this like just a game or two? And I think the like title of that experience was just sideline coverage experience or something like that. And then I had listed it out. Whereas all your other experiences are more like a paragraph format. And if there's one coverage that was really influential, certainly go ahead and make that its own experience and talk more about it. But I ended up just having one that was like a catch-all for the rest of the coverage, and included my sports med experience in that. I can't remember if I put Noe in that or not.
Yeah, that 10 experiences thing really threw me for a loop because I was expecting the old kind of format. And so I had to really chunk things into categories, and that's what I did. So like if there was like for example, I went back to my hometown and covered a lot of like athletics. And so I bullet like Lowndes County athletics and then put all of the stuff that I covered longitudinally up under it. So just figure out a way that you can kind of split things off into categories, because it's probably the only way you'll get all of your coverage on there, presuming you've like done some kind of diversity of coverage.
So the which experiences are important to include, I mean, it's like whatever you're passionate about. Obviously, coverage and any sportsman experience is important to include there, but I had like my summer job in college because I'm still really passionate about it, and I had coaching a team in med school. Like I just kind of had a random potpourri of things, probably only a quarter of which were actually related to sports med, because those were the things that I was passionate about talking about, and I felt like I don't know, highlighted the parts of my character, the parts of my experience that I wanted to be talking about in an interview.
I think that's a really good point. I found that programs really were interested in you as like a person, like you're going to be their fellow, whether it's one person, two person, or multiple people. They want to know that you're not just going to be a robot churning out ultrasound injections. They want to know that you're going to be like a rich person with a really good character. And so showing those like different aspects of you is really important. However, you can kind of form that in your CV or personal statement. That's another really good avenue to kind of throw those things into. Incorporating scholarly activity as well, whether that's like if you wrote book chapters or anything else that you did with mentors, other attendings, as well as any like teaching that you did. Because I found that certain experiences that I was super passionate about, I would teach about in residency. And those things kind of shone through in my application and acted as really good talking points.
Jumping down to the most recent question, I would, if med school experiences were important to you, I would include them. I did for sports med. So I, in my, again, like sports med coverage item of the 1 of 10, I included, you know, X number of hours in sports med clinic and med school, or whatever continuity of coverage I did then.
Or if you have a really unique experience before residency that you want to highlight and talk about that during your interview. I had something from medical school that I did that I included as its own experience, and that was a talking point for quite a few of the different places I interviewed at. So I don't think that programs are looking and not taking something seriously just because it happened prior to residency. If it's something that you feel like it's relevant and important and it's a good talking point, then include it.
I think 80% of my application was pre-residency, honestly, because you just don't have time in residency to like have this impressive life. So it was a lot of copy paste from my residency application and then just added a coverage bullet.
Hey,
Yeah, I think I added something from even before medical school, but it just was directly in line with one of the themes that I had in my personal statement, and it just kept things very tight thematically. And it always came up during interviews for me.
so something from undergrad would be okay too, if it was like longitudinal in undergrad.
Yeah, definitely.
Yeah, if it's certainly demonstrates that commitment and you're building leadership off of it, that's probably stronger than, you know, something that would have been in residency for a few games or, you know, minor coverage. I think they can sniff that out in terms of, you know, where the commitment is and what you're passionate about.
Thanks.
I'll speak to Eric's question about research, because I will say I was super concerned about this coming from a very research heavy, like, you know, as I said, super strong framework program, and having no research. I was really worried that was going to matter a ton. And there were a couple interviews where it came up, but I mean, I explained like my interest in my trials and attempts, and was candid about that being like knowing that was a weakness in my application, and so saying that's something I really want to prioritize having the opportunity to do in fellowship because of that. And I don't feel like anyone thought poorly of me, and UW caps me and they care a lot about research relatively, so it doesn't matter a ton in the end. It can look hella impressive if you have the kind of research that the Dr. Swishers of the world do, but I don't think it hurts you a ton if you don't, so long as you like name it.
I agree. I think this is a question a lot of people have anxiety about going to the process because they may not have opportunity to have research because of their wherever they're coming from. And that doesn't preclude you from going to a specific place. If you want to be more academic in your career, then explain that in your personal statement that it's something you're looking forward to get involved in with your career and moving forward. I don't think lack of research going into the interview process is necessarily going to prevent you from getting an interview anywhere.
I think that's where we may have to end this call since there's the EMIM PEDS is next to follow. But thank you again to all the panelists. This was very helpful. Obviously, a lot of good questions asked, a lot of good questions addressed. Thank you again, and appreciate all your time, effort. Congratulations to the newly matched fellows and liaisons, and we look forward to seeing what you accomplish. You guys are doing great work. So thank you all for tuning in. Have a good night.